Hello, I am Sandeep Dahiya, Director of Advocacy and Communications at Pure Earth. We received a good suggestion on our social media where the user asked us to record a video summarizing lead exposure source, scale, impact, and solutions. And here we are with a short video on the same. To start with, lead is a heavy metal and it's been in use for centuries. And if it is contained and not being spread in the environment and humans are not exposed, it's a very useful metal. But we have found cases where lead is mishandled and it's spread in the environment through environment. Kids, pregnant women, and population at large is exposed. Once lead is in our body, it can cause severe health damage. The most serious impact is on development of the brain. It can reduce up to 4 to 5 IQ points, which in terms of schooling means 2 years of loss of schooling. So a kid who can solve problems of a 7th class may not be even able to solve problems of 5th class. There are cases of memory loss, and the impacts are not only limited on the brain. In pregnant women, it can cause stillbirth, low birth weight, and in adults, it can even cause cardiovascular deaths. Globally, as per the recent World Bank paper published in Lancet Journal, more than 5.5 million people died from cardiovascular deaths, those were associated with lead exposure. And of these 5.5 million, 1 million deaths were in India. And if you use the modeling and extrapolate it in terms of economic loss, India lost 9% of its GDP. All these states are in reference to the year 2019 data set. So if the scale of lead exposure is so high, why haven't we acted on it? It's not that we haven't done anything. The historical sources of lead exposure were lead-laden petrol and paint. Both of these are banned in most of the country worldwide and in India as well. But then there are other sources that were hidden, and now we are getting to know about those. And those are adulterated spices, especially turmeric and red chili powder, metallic cookware. Aluminium cookwares are found to have very high concentration, and that also include brass metal cookwares. Toys, and then we have found high concentrations in the cosmetics as well. Surma is one of them. Ayurvedic medicines also found to have high lead content. So the sources of lead exposure are widely distributed. But even though the problem is of such a scale and it is spread through multiple sources, Pure Earth over the last 2 decades have tried and tested multiple strategies and come up with innovative solutions to control lead exposure and reduce lead poisoning. And we follow simple 5-step strategy which can be adopted in any country by any philanthropy, any institution. And here are those 5 steps. Blood lead tests. The tests will help us understand the lead poisoning prevalence. and it will also indicate where are the hotspots. Once we know the concentration of lead in kids, pregnant women, and at larger population size, we then can follow it up with the second step, that is source apportionment, source identification. By going there in those households or in the markets, picking up products which are suspected to have lead contamination, testing those with XRF or in the laboratories for lead content, and the sources or the products that are found with lead, marking those separately and doing extensive supply chain tracking, manufacturing process study, we can control the distribution of these lead contaminated products. So as I said, post the source identification, the intervention need to be designed, which can be as simple as cleaning up the contaminated area. In case of used lead acid battery, if there is a legacy site, we can simply go there, test where the contamination is, and clean up those places that may include households, schools, playgrounds. So maybe covering open area with the clean soil and all. But it can also include designing new policies or implementing existing policy and standards. The education awareness part of whole this solution process is the fourth and is a critical one. Having this knowledge of high lead concentrations, where and how, can then be communicated back to the community and other stakeholders, which includes obviously government, philanthropy, and industries, letting them know that these are the potential sources of lead exposure in this area, and we need to control, avoid, and eliminate those to control the exposure, can help in reducing lead poisoning cases big way. And then the fifth step is solution and sustainable solution implemented at scale. So the sources that we find, the blood lead level test that we do, those need to be conducted at scale. And if you are finding the prevalence and sources spread across borders and common across geographies, there need to be a much bigger and sustainable solution to put in place to control that particular contamination and ensure that it doesn't come back once it is eliminated. So for all this, we all need to join hands. Industry has its own role to play by making their manufacturing processes better, keeping a close surveillance of all the standards, and then also ensuring their supplier, distributor, collectors, everyone in the supply chain is aware of lead poisoning, lead exposure, and know what to do and what not to do in this regard. Government has their own role in terms of forming the policy, implementing those, and monitoring those. So we all have our own roles to play, and we all have to join hands to solve this problem, to save our future generation from lead exposure and take our country and states GDP at a bigger size scale.